Welcome to Nursing Library YouTube channel. Today's topic is gynecology. What do you mean by postpartum? During pregnancy, during intranatal, during delivery, after childbirth. And the answer is after the childbirth. Prepartum means during pregnancy. Intrapartum means during process of delivery. Tablet of iron and folic acid should be started in 14 to 16 weeks, 10 to 12 weeks, 1 to 2 weeks, 13 to 15 weeks. And the answer is 14 to 16 weeks. What do you mean by Sheehan's syndrome? Decreased function of pituitary gland, decreased function of hypothalamus, increased function of thyroid gland, increased function of adrenal gland, and the answer is decreased function of pituitary gland. Signs of labor includes a bloody sticky vaginal discharge, painful abdominal contractions every 20 minutes or less, bleeding, and the answer is both A and B. A bloody sticky vaginal discharge and painful abdominal contractions every 20 minutes or less. The first fetal motion felt by the mother is known as Chadwick sign, Osiander sign, quickening, Gödel's sign, and the answer is quickening. Number of antenatal visits should be at least 5 times, 3 times, 4 times, 2 times, and the answer is 4 times. The standard way of calculating the due date of a pregnancy is done by Charlie's rule, Nagel's rule, Snellen's rule, rule of 9, and the answer is Nagel's rule. Nagel's rule is used for EDD calculation. LMP stands for late menstrual period, last menstrual period, last menses period, late menses period, and the answer is last menstrual period. Lateral grip is used to find out fetal head engagement, fetal back, breech presentation, degree of flexion of head, and the answer is fetal back. Comprehensive health assessment of a woman includes all except financial, physical, emotional, psychological, and the answer is financial. Breast self-examination can be done in a menstruating woman once in a month, after menstruation, on the first day of menstruation, during menstruation, none of these, and the answer is after menstruation. Maternal morbidity and mortality can be reduced by regular health checkups, frequent antenatal visits, health assessment, all of the above, and the answer is all of the above. The measurement of a person's weight to height ratio is BMI, BIM, MBI, MRI, and the answer is BMI, body mass index. The urine pregnancy test result shows 2 parallel red bands which indicates positive results, negative results, error, good result, and the answer is positive result. Syphilis is a respiratory tract disease, sexually transmitted disease, gastrointestinal disease, neurological disorder, and the answer is sexually transmitted disease. Human placenta is discarded in red bin, blue bin, black bin, yellow bin, and the answer is yellow bin. The scientific study of human body measurements is known as anthology, depth perception, anthropometry, anthrax. And the answer is anthropometry. Temperature of the labor room should be maintained between 25 to 28 centigrades, 22 to 30 degrees centigrades, 22 to 25 degrees centigrades, 24 to 32 degrees centigrades. And the answer is 25 to 28 degrees centigrade. At what age you may identify risk factors which need specific attention and appropriate action? Above 30 years, below 30 years, above 40 years, below 40 years. And the answer is above 40 years. Body mass index of a healthy person is less than 25, more than 25, less than 18, between 18 and 25. And the answer is between 18 and 25. Fetal heart rate more than 160 beats per minute indicates fetal distress, jaundice, neonatal hyperthermia, anemia. And the answer is fetal distress. Pelvic organ prolapse examination should be performed in dorsal lithotomy position, dorsal recumbent position, supine position, prone position. And the answer is dorsal lithotomy position. Positive pap smear test results in pregnancy, malignancy, tumor, infection. And the answer is malignancy. The emergency drug placed in the emergency tray for eclampsia patient is nitroglycerin, magnesium sulfate, calcium gluconate, dopamine. And the answer is magnesium sulfate. While plotting partograph, you will find that the pregnant woman with good uterine contractions but cervical dilation still less than 4 centimeters. Then patient is in latent phase, alert phase, active phase, delay phase. And the answer is latent phase. Plotting of fetal heart sounds, cervical dilation, blood pressure and pulse are the essential components of active management of third stage of labor, essential newborn care, partograph, non-blanching rash. And the answer is partograph. A maternity wing includes the following except receiving area, delivery room, post-delivery observation room, dressing room. And the answer is dressing room. As per Government of India guidelines, only one ultrasonography is done at 20 weeks, 15 weeks, 10 weeks, 19 weeks. And the answer is 19 weeks. 0.5% chlorine solution can be used for 10 minutes, 20 minutes, 24 hours, 48 hours. And the answer is 24 hours. Thanks for watching.